Hi everybody. Today we're going to talk about joint mobilizations for the ankle. So if we have Miranda here, by the way, Miranda is modeling her Rowan field hockey sweatshirt. In all of our videos we're going to have some form of Rowan representation, and yes, that will be part of your quiz. But let's say Miranda here has limited dorsiflexion ankle range of motion, and we can measure that using the knee to wall test. So I'm going to have Miranda stand up. We're just using our front door here. So you place the foot a few centimeters away from the wall and see how far you can bend your knee while still keeping your heel down to measure ankle range of motion. You can see she's picking up her heel a little bit, so as a clinician you want to make sure you hold that down. So we're looking for 6 to 10 centimeters is normal, and of course we can also compare to the other side. Okay, I'm going to have you hop back on the table. So let's say she had an injury in which she's limited with her dorsiflexion range of motion. Of course, we can do some passive stretching like so, but we also want to mobilize the joint. So slide back just a little bit. So we'll talk about the convex concave rule, but to mobilize the ankle joint to improve dorsiflexion range of motion, we need to glide the talus posteriorly. So I'm going to stabilize at distal tibia and fibula here. My web space is right over the talus, and I'm gliding the talus posteriorly. You want to apply a little bit of traction to separate the joint before you apply your posterior glide. So you would do this for 2 to 3 oscillations or glides per second for about 20 seconds, and then in between that you can go ahead and stretch out passively like this. Now, to improve ankle plantar flexion, we can bend the knee, put the heel near the edge of the table, and gently do passive plantar flexion. But to do some joint mobilizations to assist that, we'll have Miranda lay on her stomach. Go ahead, flip over. Again, some mild traction and applying an anterior glide this way. Remember, the open packed or loose packed position for the ankle is about 10 degrees of plantar flexion. So we just want some mild plantar flexion. The same goes for the posterior glide that I just did. We want 10 degrees of plantar flexion. That allows for a maximum amount of joint play. Now, if we wanted to mobilize the subtalar joint, we would stabilize the talus with the forefinger and thumb, grab onto the calcaneus, and we're going to glide the calcaneus medially to improve ankle eversion, and glide the calcaneus laterally to improve ankle inversion. Now let's talk about the convex concave rule and why we're mobilizing in different directions. So we take a look at the ankle. We have concave surface and a convex surface. So with the tibia being the concave surface and the talus being the convex surface, we need to mobilize the joint in the opposite direction of which it's moving. So in other words, we're gliding the talus posteriorly to improve dorsiflexion and anteriorly to improve plantar flexion. We also can see a lateral view here, the concave surface of the tibia, the convex surface of the talus. The green part here is just the fibula that's overlying this area, but we can see the arrangement of the convex and concave surfaces here. We're also going to talk about the grades of movement. So I was just showing some gliding, but there are different grades of gliding. So a grade 1 glide is just the first 25% of the available joint gliding motion. So it's a mild movement at the beginning. A grade 2 is a larger movement towards about halfway of the available glide. A grade 3 is from halfway to the end. A grade 4 is the last 25%. And a grade 5 is not what we're focusing on today. Grade 5 is manipulation beyond the patient's control. All of these can be controlled by the patient with muscle contraction limiting how much movement takes place. We're doing 2 to 3 glides per second for about 20 seconds and repeating that several times. So to show you what we mean by glides, I'm going to show you with a sponge and a book. This book here is called Outliers. If you're looking for a non-athletic training read, this is a very good book. I recommend it. But we're using this book here to demonstrate our grades of glide. So with this sponge, a grade 1 gliding, remember we're talking about how much slide or glide is available within that joint. A grade 1 glide is just the first 25% or so of the available glide. A grade 2 is about halfway through the amount of glide. Now grades 1 and 2 are for relieving pain primarily. At grade 3, I would push all the way to the end of the available range of motion, back up about halfway, and I'm going from halfway to the full amount of glide. I'm not returning to the beginning, I'm only returning to the halfway point. At grade 4, I push all the way to the end of the available glide, back up about 25%. I'm just doing the last 25%. Grades 3 and 4 are primarily for improving range of motion. That's all I have for today. Please try that on a family member or someone available to practice your techniques on, and we'll see you next time.